This next module, we'll be talking about hearing aids, one of the most common forms of amplification used with children in the classroom. This next module that we are presenting to you is on hearing aids. That's one of the first and foremost ways that we treat children with hearing loss that's due to some type of inner ear issue or problem. We'll try amplification and hearing aids. There are many different styles and sizes of hearing aids based upon the age of the client, the needs for their hearing loss. We have what we call in-the-ear hearing aids, even that fit completely in the ear like this. It's a custom mold. We have a completely in the canal hearing aid, which you can't even see when you're looking at the ear and you're facing the person. But the type of hearing aid we will discuss today is called a behind the ear hearing aid, also known as a BTE. It is the most often type selected for infants and toddlers and younger children, typically due to the ability to have an ear mold which can adapt to changing ear canals. It also allows for the assistive devices and FM systems to be coupled to it. So for children up to age 12, you will often see a BTE hearing aid. And in this module, we will teach you how to maintain that and troubleshoot the BTE hearing aid in case you do have a young child whose hearing aids have gone dead. We will go through actually troubleshooting a hearing aid, because if there's problems with technology, the problems will typically occur in the classroom and could affect the child's academic learning. Common signs that a signal or a problem is occurring is that all of a sudden the child does not seem to be paying attention any longer, especially if the child is typically one that is really focused upon you and listening in the classroom and making progress in school. Sometimes the student doesn't seem as responsive. You have to call them several times. Perhaps the student says huh or what or ma'am or sir, and when they did not used to ask for repetition nearly as often. A lot of times we notice it after a period of time the child is no longer making progress in school or in speech therapy or other types of therapy. You may have a concern, or the parents may have a concern, that their child is no longer listening or hearing as well as they used to. Sometimes changes in behavior are noticed, like the child simply tires out more often than he used to. It's called auditory fatigue. Listening intently in the presence of background noise or at a distance is very hard work, and children can easily become tired. And so if you see that they're tiring out, or that child is tiring out more often than normal, that's also a sign. And sometimes the child would just zone out. They're not able to hear, and so they just start thinking about other things, or they start doodling, or they manifest in other behaviors of playing with their classmates when they typically don't do that. A lot of times, if it's a younger child, the hearing aid's not giving them any type of benefit, they just don't want to wear it. They'll take it off. Or the child or student does not respond to speech like they used to or that person used to. That's another sign that something may be going on with the hearing aid, and you would like to do some type of listening check with it. So when you're doing some basic troubleshooting techniques with a hearing aid, always make sure the hearing aid is turned on, first and foremost. The second thing you want to do is check the battery of the hearing aid. Make sure that it's still good, it's still working. Then when you actually put the hearing aid on a stethoscope, you're going to be listening for intermittency, scratching, squealing, a distorted type of quality, or is the signal crisp and clear? And then there may be the possibility that you'll notice that there's some wax in the ear mold, or a lot of condensation or sweat in the ear mold. You may need to actually clean it or blow it dry. So these are some common things that teachers can do with a behind the ear hearing aid. So what happens if after your listening check you look and you say, well, yes, that hearing aid sounds very good. I'm listening to the ling sounds. They all sound crisp and clear. Everything is clean. The battery's working. The hearing aid is turned on. So the hearing aid sounds right, yet the child is still responding as if he's not hearing sound. Other things may be going on with the child, such as perhaps there's wax blocking the ear canal or fluid in the middle ear. Perhaps the child has a progressive hearing loss and his hearing took a turn and has now progressed into a worse category. If you have any concerns about your child or your student, please refer to the audiologist, and the audiologist can do a hearing test on the student or somehow intervene in an appropriate way.